what a difference a month makes. A lot has changed from August to now, and the real question is this just another decline or will it be sustained? This time last month, North Texas was in the middle of the new COVID surge, fueled by the Delta variant. Hospital staffing was stressed, some setting up overflow tents. There were no pediatric ICU beds available. But it was also when modeling or forecasting projected the tide would turn in September. Those forecasts are now reality. North Texas hospitalizations peaked at nearly 3,600 patients earlier this month, and there's been a sizable drop, 2,600 COVID patients as of Tuesday, the lowest since August 12th.
So it's been going like this now for the last few weeks. Now you're starting to see more of a decline, but as I said, it's pretty slow.
We talked to Dr. Peter Hotez, Dean for the National School of Tropical Medicine at the Baylor College of Medicine in Houston. He says there are multiple factors that played a role in the new decline, aside from an increase in some masking and vaccinations. That includes a decreased risk pool. But he cautions, just because someone has recently been infected, in his opinion, does not mean natural immunity is better.
Bottom line is if you're infected and recovered, you still want to get vaccinated. And by the way, if you do, that has a really good impact, because if you're infected and recovered and vaccinated, you seem to have really good levels of virus neutralizing antibody, and you're really resilient against the variants.
The latest UT Southwestern model shows in Dallas and Tarrant counties, hospitalizations dropped around 15% in the last 2 weeks. The latest COVID forecast also predicts a continued decline in almost all age groups. Pediatric cases also have been a concern. Currently, there are 60 pediatric COVID patients in North Texas. A few weeks ago, the pediatric number was 131. Dr. Marcial Oquendo works in pediatrics in Dallas and is with the Dallas County Medical Society.
The numbers of kids who had COVID in schools went up quickly, and then it started to go down, which means that there's a pool of people who could get exposed and had it that have already gone through it.
There does not appear to be a bump in community spread from the Labor Day holiday and other activities like football games and concerts. Dr. Hotez says 6,000 Texans died during the summer surge, and he expects another spike in cases again in the winter.
The way I think of it is we just got through the eye of the hurricane, but guess what? There's more in store for us. And so even though it is starting to go down, we still have a ways to go, and there's no cause for celebration. And if you've not been vaccinated, now's the time to do it.
And Hotez also said while the cases and hospitalizations are going down, just like from the start of this pandemic, deaths are a lagging indicator. So don't be alarmed if you see more reported deaths in the future, in the coming days and weeks. Yesterday, we reported a child under the age of 15 with underlying conditions dying from COVID.